Chronic low back pain is low back pain that you're experiencing frequently, a lot of the time, and for a long period of time. It's just one of those things that isn't going away. You might have breaks from it, but it's this constantly recurring low back pain that's become just a part of your life. The traditional approach for low back pain is usually to take some sort of painkiller like an aspirin, an Advil, Tylenol, or muscle relaxants to help relax the muscles in the low back. Sometimes stretching or other exercises are done. Unfortunately, a lot of this doesn't get to the root cause of why the back pain is there in the first place, which is usually a stuck or misaligned vertebrae affecting discs or nerves. And that's where we come in. How we approach low back pain is to look at the movement and alignment in that spine and to do adjustments to correct and restore the normal motion. So low back pain is made worse in today's world by a lot of things that we do. Smoking has been shown to decrease the fluid in the discs and the joints of the body. Obesity is another major causal factor, or stressor anyway, of chronic low back pain. Simply just carrying around more weight on damaged or injured or stuck joints in the body is going to increase pain. And number two is the weight distribution. So having this weight out front is pulling and putting extra stress on that low back, pulling you forward. The muscles in the low back have to tighten to try and keep you upright. It's just amazing the amount of extra force that a few extra pounds hanging around in the front can create on the low back. Mental stress, interestingly, is also a huge factor in low back pain. There's a lot of reasons that this goes on. It can increase inflammation in the body. That inflammation takes any problem that you have and amplifies it. And it can increase muscle tension in the body, decreasing blood flow, a lot of different things. But mental stress can be a major risk factor for chronic low back pain. Probably the most common thing, the most common factor that increases our low back pain is the amount that we sit. We always say that sitting is the new smoking, and we just live a sedentary lifestyle right now. The low back is not designed to sit. It puts so much extra stress and force into those joints, into those discs of the spine, and that causes early degeneration and chronic low back pain. The best way to solve chronic low back pain is to figure out the cause of it, and that's almost always stuck, misaligned vertebrae. And so movement is super important. From a chiropractic perspective, making sure that the spine is well adjusted so that things are lined up and moving correctly. And then worrying about our weight, our diet, making sure that we're eating foods that don't promote inflammation and aren't increasing weight. Most chiropractors deal with low back pain and do it very effectively. So you're going to be pretty safe in almost any office that you're getting good care for the low back. In our office, Discover Chiropractic in Chaska, Minnesota, we've been dealing with these types of issues for 15 years with great results from the different techniques that we use and some of the therapies to help solve this where it starts.